So there are some gaps in the data that we need to really understand low fertility and policy making. And I think some of the gaps are sort of what you would think. So although we have all of these different fertility and family policies, they might give out generous amounts or they might on paper seem very good. But what we're missing is sometimes who isn't covered under those policies. So for example, think about paternity leave or maternity leave. It's really important to look at not only what is offered, but actually who's ineligible. So often for many women, it might look like they have a long maternity leave or they might have excellent benefits, but that's only for those that are formally employed. Now there's a huge group of women that are informally employed or they're self-employed and they are ineligible. So it's really important to dig deeper into that data to see, who are these policies not reaching. That I think we can do some more work on. Another aspect is we often use sort of traditional data sources and methods. So we rely on census data or we rely on surveys. And increasingly, there's a lot of other different types of data we can use, from digital data, satellite data, all of these different types. And we can think about, for example, using geospatial data to understand how are people moving across a city? How are they moving from school to work? And that would allow us to locate childcare in a more efficient place. And that would allow us to think about and understand these and make more efficient policies. I think something that we're often missing is taking an interdisciplinary approach. Often we look at family policies from a purely social mechanism or social side. I think what we're missing is looking at medical factors and health-related factors. South Korea has one of the oldest age at first birth of many societies. So women are having their first child on average at age 33. Now, what we seem to be really missing is looking at the biological or the medical data in relation to this. Are they increasingly having problems? We know that when you're trying to conceive, this is increasingly a period where you're less fecund. So these are really issues that are important. Another aspect is we recently studied linked medical records with childlessness in Finland and Sweden, where there's very high levels of childlessness, around 1/3 of the population now who have reached the end of their reproductive window. And what we found when we linked it to medical records of the entire population is that mental health was a huge issue, and as well inflammatory diseases, so related to chronic stress. And for men in particular, it was alcohol and alcohol intoxication and stress. So these issues actually are very important. So we've been missing out of looking at mental health and looking at chronic stress. So those are some of the sort of data gaps that I can see at the moment.